Magandang araw po sa inyong lahat and welcome once again to another pre-recorded video lecture for the subject Theoretical Foundations in Nursing. And this is already our week 6 of discussion. Last time, we talked about the different theories of Virginia Henderson and Joyce Travelby, and this week we will be learning about the nursing theories promulgated by Ida Jean Orlando and Faye Abdella. So please bring out your notes and your pen so that you can follow along our discussion. Now let us zero in on the concept of nursing by Ida Jean Orlando Pelletier, who forwarded or who came up with the deliberative nursing process theory. According to Ida Jean Orlando, nursing is responsive to individuals who suffer or anticipate a sense of helplessness. We all know that when our patients get sick or they are infirm, they have a feeling of helplessness. And we nurses need to provide them with the help and the necessary care that they need so that they can regain their ability to do activities of daily living. Aside from that, Ida Jean Orlando also believed that nursing focuses on the process of care in the immediate experience. And nursing is also concerned with providing direct assistance to individuals in whatever settings that they are found for the purpose of avoiding, relieving, diminishing, or curing the individual's sense of helplessness. So, Ida Jean Orlando Pelletier mentioned that we nurses work in several settings, be it in the individual or bedside care nursing, be it family, be it the community or even the society. We have the ability to help these helpless communities or patients so that they can also have a sense of health in them. And also, nurses work to help these patients avoid, relieve, diminish, or cure their sense of helplessness. So, basically, we nurses also promote, cure, and help rehabilitate our patients from their sense of helplessness. So that is the concept of nursing according to Ida Jean Orlando Pelletier. Now, another important thing to note is that we nurses should converse with our patients and let them know what the plan of care will be. So we have the responsibility to work or collaborate with our patients and tell them our course of action or what we are planning to do with them, with the care that they will be receiving. Because Ida Jean Orlando also believes that nurses and patients should work together for the plan of care. Now, however, regardless of how well thought of our nursing plan is, there are unexpected problems to the patient's recovery that may arise at any time. And with this, our job as nurses is to know how to deal with these problems so that the patient can continue to get back and reclaim their sense of well-being. So di ba nga meron silang learned helplessness yung mga patients natin when they are sick or infirm, and we nurses also have to assist them so that they can reclaim their sense of well-being. Aside from that, Ida Jean Orlando also developed her deliberative nursing process that allows nurses to formulate an effective nursing care plan that can also be easily adapted when and if any complexity comes up with our patients. So the theory of deliberative nursing process by Ida Jean Orlando gives us an idea of how to properly approach our patients in terms of the problems that may arise when they are under their care, and it also gives us a sense of creativity in approaching these unexpected occurrences that happens during our interaction with our patients. So yun po yung deliberative nursing process theory, which we'll learn more about later on. But first, let us get to know Ida Jean Orlando Pelletier even more. Now, sino ba kasi si Ida Jean Orlando Pelletier? Ida Jean is an associate professor. She was also a nurse educator. She is also a director of the graduate program in mental health psychiatric nursing and a project investigator of a national mental health psychiatric nursing. She was also a director of research project and a board member of Harvard Community Health Plan. So as you can see, Ida Jean Orlando Pelletier was a very accomplished nurse and a nurse theorist. Now, what is important to note about Ida Jean Orlando is she considered nursing as a distinct profession that is unique and different from other healthcare professions and discipline. And she believes that we nurses hold a position in the healthcare team that is very indispensable. So sabi niya, naniniwala si Ida Jean Orlando na tayong mga nurses daw ay uniquely different from these other healthcare professionals like doctors, midwives, mga physical therapists, mga rad technologists. We offer a unique skill set, knowledge, values, and attitudes that will help our patients regain their health. Yun po yung paniniwala ni Ida Jean Orlando. And also, she separated nursing from medicine. Naniniwala siya na magkaiba po yung nursing profession and the medicine or the medical profession, where nurses determine nursing actions rather than they are being prompted by physicians' orders. So, Ida Jean believes that we nurses have our own independent functions and we do not really look at the doctor's orders so that we will know what to do. Hindi po yon yung paniwala ni Ida Jean Orlando Pelletier. She believes that using our own skill set, our knowledge, our values, and practice as nurses, we are able to come up with our own nursing actions to take care of our patients. And she also believes na yung mga doctor's orders daw or your physician's orders are not exactly for nurses. Hindi po yun yung mga orders ng doktor para sa atin. But these are orders for the patient. So it circles back to the idea what Ida Jean was saying, that we nurses have a unique knowledge and skill set that we also bring to the table. So naniniwala siya that we do not need the physician's order in order for us to know what we should do with our patients. Alam na daw natin yon because we have been trained and prepared to handle our patients, and that the physician's orders are just orders for the patient to follow. Yun po yung paniwala ni Ida Jean Orlando. Now let us zero in on the deliberative nursing process theory by Ida Jean Orlando Pelletier. But before we dive any deeper to her theory, let us first understand the meaning of the word deliberate, which is the root word of the term deliberative, from the deliberative nursing process. So ano bang ibig sabihin ng deliberate? When we speak of deliberate, it is defined as something that is done consciously and intentionally. So, ibig sabihin, yung mga deliberative nursing actions daw natin ay dapat pinag-iisipan. That is something that is born out of our own consciousness and our intention. So, gusto natin yun talagang gawin at yun talaga yung dapat nating ginagawa na pinag-iisipan daw natin. Ibig sabihin, our deliberative nursing actions are not done by accident. Talagang meron tayong basis why we do those things and how we do those things. So yun pong ibig sabihin ng deliberative nursing process theory. Now, what is the main soul or the gist of the deliberative nursing process theory according to Ida Jean Orlando? According to her, nurses should converse with the client and let them know what the plan of care for the day is going to be. So dito po pumapasok yung importance of communication. We have to tell our clients what we are planning to do with them and what the care that they are expected to receive during that day. Because by doing that, we also are able to get the cooperation of our patients, and also by doing that, we are also including our patients in their plan of care. Lagi niyong tatandaan ha, meron dapat collaboration between the nurse and the patient. Aside from that, like I said, regardless of how well thought out a nursing care plan is for a client, unexpected problems to the client's recovery may arise at any time. So dito po pumapasok yung ating creativity and yung ating thinking on our toes, or ibig sabihin we are critical thinkers that when the need arises, for example, meron tayong mga pasyente na may fever and we are telling them, ma'am, ganito po yung gagawin natin, di ba? We converse with our patients. Ma'am, magbibigay po tayo ng paracetamol and that's based on the doctor's order na iti-take dapat ni patient, and mag-i-increase po tayo ng oral fluid intake or dadamihan niya ng tubig na iinumin. We will also change the clothes of our patients to something that is more aerated o yung mas presko, and dapat po ay magre-rest yung patient natin para mawala yung fever. Now, no matter how well thought out that nursing care plan is for our patient's fever, may mga instances pa rin po that there are unexpected problems that may arise. Kunwari, yung patient mo, nagka-convulsion or nagkaroon siya ng mga benign febrile convulsions during your plan of care. So dito po pumapasok yung critical thinking natin and our ability to become creative and use the empirical knowledge that we have to address the situation. So sabi dito, with this job, the job of the nurse is to know how to deal with those problems so the client can continue to get back and reclaim his or her well-being. So in that plan of care, we should also anticipate several problems that may also arise. So dapat as nurses, we are able to address these concerns so that we can help our patients reclaim their well-being. So kunwari yung patient natin na nagko-convulsion, ano yung gagawin natin, or nagkakaroon siya ng chills, what will we do? So pag ganun yung mga nangyayari, what we usually do is we give our patients blankets or nagbibigay kami ng warm packs sa kanilang mga soles of the foot in order to relieve the chills na nararamdaman ng pasyente. Or sometimes we refer them to the doctor so that they can be given yung ating mga tranquilizers to prevent them from having those seizure reactions or benign febrile convulsions. So yun po yung mga binibigay natin. So like I said, you should not only be able to know how to deal with these problems or yung mga plan of care, but also you have to anticipate the other unexpected problems experienced by the patient when they are under your care para ma-reclaim nila yung kanilang well-being. Now, let us look at Ida Jean Orlando's meta-paradigm in nursing. Ano nga ba ang tingin or idea ni Ida Jean Orlando Pelletier sa ating concept of nursing, person, environment, and health? Now, according to Orlando, nursing is seen as a unique and independent in its concerns for an individual's need for help in an immediate situation, and that the efforts to meet the individual's needs for help are carried out in an interactive situation and in a disciplined manner that requires proper training. Naniniwala si Ida Jean Orlando na ang nursing makes use of our knowledge, our skills, and our attributes as nurses, and dapat po it is also interactive in nature. So ibig sabihin, we have to converse with our patients and talk to them so that we can also gain their cooperation during our plan of care. So binibigay natin sa kanila yung ating plan of care, and then we cooperate with each other so that we can help our patients reclaim their well-being. Aside from that, she also mentioned the term disciplined manner that requires proper training. At naniniwala si Ida Jean Orlando na hindi kung sino-sino lang yung pwedeng maging nurse to care for these sick patients. They should require training, and that their actions should be deliberative in nature. Dapat conscious itong ginagawa at intentional itong ginagawa, and it is based on science and research and our empirical knowledge. Now, Ida Jean Orlando also believes that the function of professional nursing is the organizing principle. This means finding out and meeting the patient's immediate needs for help. Anong ibig sabihin nito? The reason why we also converse with our patients and show them our plan of care so that we can also identify what the problems of our patients are and prioritize them using the patient's help. According to Orlando, nursing is responsive to individuals who suffer or anticipate a sense of helplessness. So dapat po we nurses are able to provide care and assistance to these patients who are sick and who are suffering from helplessness. Di po ba pag kayo ay may sakit, kayo ay nagiging helpless? Anong ibig sabihin nito? Kayo po ay hindi naaalagaan yung inyong sarili or wala kayong ganang kumain. You're helpless. And that is the job of nurses, to help our patients in their times of helplessness. Aside from that, Ida Jean Orlando also believes that nursing is focused on the process of care in an immediate experience. So dapat po yung pasyente natin, pag once na nagkaroon na sila ng sakit and there is a feeling of helplessness, dapat po we are there to assist them already so that they can immediately reclaim their well-being. Aside from that, she also believes that nursing is concerned with providing direct assistance to a patient in whichever setting that they are found to help them avoid, relieve, diminish, or cure their sense of helplessness. So ito po yung main meat ng kanyang deliberative nursing process theory. Kailangan daw po ay tulungan natin ang ating mga pasyente with their sense of helplessness. Now, in Ida Jean Orlando's meta-paradigm in nursing, the person is defined as someone who is the recipient of nursing practice, or Ida Jean Orlando also referred to them as a human or person who are the focus of nursing practice. So ito po yung mga tao na may sakit, or that those who have a sense of helplessness or infirm that need assistance of nurses. So ito po yung mga persons natin who are the recipients of care because of their sense of helplessness. Now, Ida Jean Orlando also, in her theory, replaced health by a sense of helplessness as the initiator or of a necessity for nursing. So kaya po kailangan daw ng mga persons, ang mga nurses, or kailangan nila ng nursing is because of the concept of helplessness. So pag may mga tao po na helpless, needing assistance from us for them to reclaim their well-being, then dun po pumapasok yung nursing. Now, she also stated that nursing deals with individuals who require help and assistance from nurses. So yun po yung concept ni Ida Jean Orlando. Now, how does Ida Jean Orlando see health in her meta-paradigm of nursing? Health is replaced by a sense of helplessness as the initiator of a necessity for nursing. Yun nga yung sinabi ko kanina. And that if a person does not feel helpless, then that person is healthy. But if a person is helpless, then that person is not healthy. Therefore, that person will require a nurse or nursing. Now, what's important to note in Ida Jean Orlando's meta-paradigm in nursing is that she completely disregarded the environment in her theory. Wala pong environment sa kanyang deliberative nursing process. She only focused on the patient's immediate needs, chiefly the relationship and actions between the nurse and the patient, or in the individual or the nurse, or the nurse and the society, families or groups and the nurse, pero wala pong mention of the environment. The effect that the environment could have on a patient was never mentioned in Orlando's theory. Unlike sa concepts ni Virginia Henderson, wherein environment is seen as something important, unlike in the environment theory of Florence Nightingale, wherein the environment is also seen as a reparative aspect na kaya daw i-cure yung ating mga pasyente. Dito po sa deliberative nursing process theory ni Ida Jean Orlando Pelletier, wala pong mention ng environment sa kanyang meta-paradigm in nursing. So, simply put, she completely disregarded the environment in her theory. Yun po yung isa dapat na tandaan nyo sa na distinct and unique sa theory ni Ida Jean Orlando Pelletier. If you ask me right now if the theory of Ida Jean Orlando Pelletier is still relevant at this day and age, my answer will be yes. Okay? Because of Ida Jean Orlando Pelletier's deliberative nursing process theory, we are able already to understand and appreciate the reciprocal relationship between the nurse and the patient. So alam natin na napaka-importante ng ating collaborative na engagement with our patients, and that we should talk to them and then tell them our plan of care, how will we approach the situation, how will we care for our patients so that they can also cooperate. Aside from that, because of Ida Jean Orlando Pelletier's theory, we are able to include our patients in our plan of care. So the client's participation in the nursing process is already considered very important because of her theory. Sinabi kasi ni Ida Jean Orlando Pelletier na kailangan involved daw yung ating mga patients in their plan of care, and that we should also, as much as possible, anticipate the unexpected occurrences that happen during our interaction and care with our patients. Aside from that, Ida Jean Orlando also believed that nursing is very distinct from medicine, and that hindi po tayo mga katulong lang ng mga doktor, and hindi po tayo inoorderan ng mga doktor para alam natin ang ating mga gagawin as nurses. Ida Jean believed that the doctor's orders are not actually for us. We don't need the doctor's orders for us to know what to do with our patients, and that the doctor's orders are actually for the patient alone, and that we have independent nursing activities, and that we have different skill sets and knowledge, and that we don't need the physician's orders in order for us to know what to do as nurses. So yun po yung paniniwala ni Ida Jean that until now we are still following. Now, Ida Jean also believes that patients have their own meanings and interpretations of situations, and therefore, nurses like us must validate their inferences and analyze with the patients before drawing conclusions. And you have to remember that these persons that we are taking care of are actually human beings, and that they also have their own inference or understanding of their own situation. Kunwari, meron kang pasyente na may difficulty of breathing, meron siyang mga lung problems kunwari, and that the person also has liver problems, meron din siyang allergies, meron din siyang fever. Pero nung pumunta yung patient sa inyo, ang sinabi niya sa inyo is, "Ma'am, ang dry-dry ng skin ko, parang ang laki ng eye bags ko. Ito yung aking priority." Okay? So ibig sabihin niyan, we nurses should also understand our patients, and that they have different priorities. Kaya nga po kasama yung ating mga patients in our plan of care, so that we can also help our patients prioritize their own problems. So marahil yung mga pasyenteng yun na yung ang kanyang problema is ang kanyang mga eye bags at dry skin, they don't really understand what's happening in their body. Meron para siyang problems in the lungs, problems in the liver. So we nurses need to make them understand what really is happening, so that they can also change their own inference and understand their own priorities when it comes to their health. So yun po yung mga binigay sa atin ni Ida Jean Orlando Pelletier sa kanyang deliberative nursing process theory, and until now they are still being applied in practice, and they have stood the test of time. Now, what are the assumptions of Ida Jean Orlando's theory? So ito po yung mga assumptions niya. Number 1 is that when a patient cannot cope with their needs on their own, hindi nila masolusyonan yung kanilang helplessness on their own, they become distressed by feelings of helplessness. That's the reason why they will seek the assistance of nurses para matanggal po yung helplessness na yon. That's where we come in as nurses. Aside from that, she also assumes that in its professional character, nursing adds to the distress of the patient. naniniwala si Ida Jean Orlando that we nurses also add to the distress of our patients. And that is the reason why we also have to converse with them, explain to them what we are going to do with their plan of care so that they can also be involved in the process and so that we can also gain their cooperation. Di ba nga may mga ibang pasyente tayo na pag nakakakita sila ng mga nurses ay natatakot, naiiyak, or mas nasistress sila because we are seen sometimes as an outsider. But we should also converse with our patients, talk to them, and then tell them what we are planning to do and that we are there to help them regain their sense of well-being. So, dapat po ay maging conversant tayo sa ating mga patients according to Ida Jean Orlando, because if not, we will be the cause of the patient's distress. So, kawawa naman yung patient, no? Helpless na nga, dinidistress pa natin. So, we should all be conversant with our patients. Aside from that, Ida Jean Orlando also assumes that patients are unique and individual in how they are and how they respond. So, ibig sabihin, we also have to give individualized care to our patients because all of our patients are unique and no two patients are the same or alike. Okay? So, nursing also offers mothering and nursing analogous to an adult who mothers and nurtures a child. So, naniniwala din si Ida Jean Orlando of our mothering roles as nurses and that we should also look at all our patients like as if they are our own children na inaalagaan natin. Now, another assumption of Ida Jean Orlando's theory is that the practice of nursing deals with people, the environment, and health, and patients need to communicate their needs in order for us to understand them, and that they are uncomfortable and ambivalent about their dependency needs. So that's the reason why we also have to converse with our patients so that they will open up to us in terms of the things that they need and the things that they feel most uncomfortable of. So yun po yung dapat nating ginagawa as nurses according to Ida Jean Orlando's assumptions. Now, what are the other assumptions of Ida Jean Orlando's theory of nursing? According to Ida Jean, people can be secretive or explicit about their needs, perceptions, thoughts, and feelings. And that we have many clients from different walks of life and some of them may become secretive or hindi nila sasabihin yung lahat-lahat ng details when it comes to their health or what they are feeling or what they're experiencing, while other people may also be explicit or yung mga tipong sinasabi nila lahat sa inyo and they are honest with what they are feeling, what they're experiencing. So, what Ida Jean Orlando is saying is that we should be very good conversationalists. Dapat we nurses should know how to communicate properly with our patients and that we should also be able to call out information from these secretive patients so that we can properly plan their care. So, lagi nyong tatandaan, hindi po lahat ng mga pasyente na pumapasok sa atin under our care are honest or explicit about what they are needing or their perceptions and thoughts and feelings. And some of them are also secretive. That's the reason why we have to converse with them or talk to them in a deeper manner. Okay? Aside from that, Ida Jean Orlando also assumes that the nurse-patient situation is dynamic and that our actions and reactions are influenced by both the nurse and the patient. So, if a patient is secretive or hindi siya masyadong nagsasabi, the nurse can also become very probing. Okay? So, because of the secretiveness of that patient, yun po yung nagiging impetus or nagiging cause ng reaction naman ng nurse na yon. Okay? So, ibig sabihin that the nurse-patient situation is dynamic and that what happens in this side also affects the other side. So, nagiging dynamic siya. The actions and reactions of the patient affects or influences the nurse, and the actions and reactions of the nurse also affects or influences the patient. Yun din po yung isang paniwala ni Ida Jean Orlando. Aside from that, Ida Jean Orlando also assumes that people attach meanings to situations and actions that are apparent to others, and these situations are also sometimes colored with our own experiences and our own situations without being seen by other people. Okay? So aside from that, Ida Jean Orlando also assumes that people enter or our patients enter nursing care through medicine. Okay? So, yung mga pasyente po daw natin, hindi naman sila talaga naghahanap ng nursing care. Wala pa po akong naririnig ng pasyente na nagsabing, pupunta ako sa hospital para magpa-nurse. Because all of what they say is, pupunta ako sa hospital para magpa-doktor, and that is okay. Our patients enter our nursing care not because of us, but because they were seeking the help of the doctor. That's okay if they enter nursing care through medicine. Okay? So, yung mga pasyente natin, maghahanap sila ng tulong ng doktor, and because of that, they also enter our nursing care. So, yun po yung isang paniwala din ni Ida Jean Orlando, which is tama nga naman until this day and age. Now, we are down to our last 3 assumptions of Ida Jean Orlando. So, the next one is that the patient cannot state the nature and meaning of his or her distress without the nurse's help or without first having established a helpful relationship with the patient. Tama nga naman po, our patients will not be able to articulate what they really need without the help of the nurse or without first establishing a helpful relationship with the patient and the nurse. Pag pumupunta po kayo sa hospital, sino po yung una na kumukuha ng mga vital signs, nag-a-assess sa mga ating mga patients, or kumukuha ng kanilang mga chief complaints, nagdo-document ng mga sinasabi ng pasyente? Hindi po ba mga nurses? Because Ida Jean Orlando believes that our patients cannot explicate or express the nature and meaning of their distress without our attention or our assistance, I should say. Kaya nga po tayo yung mga una na tumitingin, nag-a-assess and evaluate sa ating mga patients so that we can also help our patients understand the nature and meaning of their own distress. Kaya nga po kailangan na na-establish natin yung nurse-patient relationship during the first meeting so that we can assist our patients properly. And di ba tayo po, mga nurses, ang pumupunta sa mga doktor at nagre-refer sa ating mga pasyente sa ating mga doktor. Doctor, this is our patient, endorsing our patient, 23-year-old female, experiencing abdominal pain, yada, 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 because we have already helped our patients understand and state the nature and meaning of their distress. Kaya po kailangan na gawin natin yon as part of our roles as nurses. Aside from that, Ida Jean Orlando also believes or assumes that any observation shared and observed with the patient is immediately helpful in ascertaining and meeting the patient's needs or finding out the patient is not in need at that time. So, ibig pong sabihin nito, anything that we say to our patients, any knowledge or new information that we give our patients will also help them understand the nature and the meaning of their distress, and that it will also help them prioritize. Ito pala yung mga nafe-feel ko, ito pala yung mga problems ko ngayon, ito pala yung mga priorities dapat. Why were they able to understand that? Because of our help as nurses. Aside from that, nurses are also concerned with the needs of the patient that they are unable to meet on their own. So dapat as nurses, we should also prioritize the things that make our patients helpless. Yung mga bagay po na hindi nila kayang gawin, dapat po tayo ang tumutulong na gumawa para sa kanila. For example, a patient is not able to swallow food. So what do? We help them attain this nutrition by inserting NGT, feeding them through the nasogastric tube, things like that. For example, a patient cannot breathe normally, or a patient is not able to attain yung kanyang homeostatic level of temperature, or laging mataas or mababa yung kanyang temperature, dapat we assist them so that this feeling of helplessness will go away. So that is those are the assumptions of Ida Jean Orlando in her deliberative nursing process theory. Now let us also dive deeper at the stages of deliberative nursing process by Ida Jean Orlando Pelletier. So that comprises assessment, diagnosis, planning, and implementation and evaluation. So these are the stages that we nurses should also undertake before we execute our care to our patients. So ano nga ba yung ginagawa natin during assessment? During assessment, the nurse completes a holistic assessment of the client's needs and the nurse uses subjective and objective data. So dito po kung pumapasok yung ating history taking, vital signs taking, interview with our patients, cephalocaudal assessment, or yung ating mga head-to-toe assessment. So ginagamit po natin both subjective or objective data. So when you say subjective, ito po yung mga nararamdaman ng ating mga patients that are symptoms. And yung mga objective naman, these are readily obvious or observable for the nurse. Yung mga nakikita niya, like for example, mga vital signs, mga ganun po. When it comes to subjective naman, these are yung pain, okay, mga types of pain ng mga pasyente. So, ginagamit po natin yung mga information na to assess our patients. Aside from that, we use that assessment, yung mga results ng ating assessment to form our nursing diagnosis. So, yung diagnosis na din po the nurse uses the nurse clinical judgment about the health problem. So, based on the results of our assessment, tinitignan na po natin what the problem is in our patients, okay? Because of the data or information that we have gathered during assessment, we are able to diagnose our patients. So, nagkakaroon po tayo ng nursing diagnosis and because of that, we are able to prioritize our care for our patients. Aside from that, ginagawa din natin ang planning. It addresses each of the problems identified in the diagnosis. So, what is your plan for this problem? What is your plan for the identified problem? What is your plan for the third identified problem? So, kung marami pong mga problema yung ating mga pasyente when it comes to their health, plano din po natin yan isa-isa. Okay? So, we deliberately, intentionally think of the nursing actions that we will do to address or solve all of these health problems. Alright? So next is the implementation. So after natin magplano, we already execute our nursing care. So in the implementation phase, the nurse uses the nursing care plan and that will guide the nurse's actions and decisions. And lastly, we will also do our evaluation. And in the evaluation phase, the nurse investigates the progress of the client towards the goals set in the nursing care plan. So, tinitignan natin kung gaano po ka-effective yung inimplement natin na care sa ating mga pasyente. And then, if that management is good or is doing well for our patients, then we continue treatment. But, if the management that we have chosen is not that good based on our evaluation, then we will have to plan another course of action. So yun po yung reason kung bakit tayo merong mga stages of deliberative nursing process so that we can do our nursing care in an organized manner. So again, kailangan nating i-assess yung ating mga patients using subjective and objective data, diagnose the patient's problems and prioritize them, plan our care depending on the identified problems, implement or execute the nursing care plan, and then evaluate the effectiveness of the executed nursing care plan. Kung maganda, retain or continue the course of action, but kung pangit po yung kinalabasan ng ating evaluation, we change strategy. So yun po yung stages of deliberative nursing process. Now, is the deliberative nursing process theory of Ida Jean Orlando still accepted by the community? As I told you a while ago, yes, it still is relevant and it still is accepted by the nursing community. Why? Because in practice, her theory is very easy to understand, it's very easy to use, ginagamit pa rin natin yung mga 5 stages of a nursing process, and it also focuses on the needs of the patient. In education, her theory or her processes of recording has made significant contribution to facilitating self-evaluation. So ginagamit din natin po yung yung kanyang theory in education in raising nursing students like you. And in research, her theory has also been applied in various research settings, and it is still used as a theoretical foundation or theoretical framework, I should say, in different research studies, and she focused on how to produce improvements in our clients' behavior. So until now, the theory of Ida Jean Orlando is still accepted in the nursing community based on what we see in practice, in education, and in research. Now, let us understand why the theory of Ida Jean Orlando is still accepted by the community. Let's have a theory analysis. Based on clarity, yung kanyang concepts po kasi, they are defined, well-defined, and the concepts that were presented were really very minimal. So, sobrang very easy to understand po yung kanyang concept. Aside from that, in terms of simplicity, it can be said that the theory of Ida Jean Orlando Pelletier is simple as it can predict statements as opposed to description and explanation. So, sobrang simple po siya. Kaya madali siyang i-execute at madali din siyang gamitin in practice, in research, and even in education. In terms of generality, it focuses on limited situations, and in terms of accessibility, it benefits research application. In terms of importance, it is also beneficial in achieving valued outcomes. So, until now, the theory of Ida Jean Orlando still stands. The second nurse theorist that we will put under our microscope is Faye Abdella, who promulgated the 21 nursing problems. Faye Abdella is a celebrated nurse theorist. She is also a military nurse and a leader in nursing research. Let's get to know the major concepts of her 21 nursing problems in nursing theory, its application, and its impact on nursing. But before we proceed to our next slide, let me share to you one of the best quotes that I have read online from Faye Abdella. She said, "I never wanted to be a medical doctor because I could do all I wanted to do in nursing, which is a caring profession." So she believed that she doesn't need to become a doctor to care for her patients because basically everything that she wants to do with her patients as a doctor, she can do by being a nurse. Who is Faye Abdella? Faye Abdella is the first woman and the first nurse to serve as Deputy Surgeon General in the United States of America. She was inducted into the U.S. National Women's Hall of Fame, and she was also a fellow of the American Academy of Nursing. She has contributed 100 publications related to nursing care, education, nursing research, and advanced nursing practice. So as you can see, she was also an author and a researcher. She also promoted client-centered, all-inclusive nursing care, making nursing a true humanitarian service to individuals. Faye Abdella was also the first nurse officer to rank a 2-star Rear Admiral, the first nurse and the first woman to serve as a Deputy Surgeon General. Now let us also look at another quote from Faye Abdella, and she said that the concept of nursing as an art and a science molds the attitude, intellectual competencies, and technical skills of the individual nurse into the desire and ability to help individuals cope with their needs. Kaya nga po, very special daw ang nursing according to Faye Abdella because she considered nursing as a science and an art. And because of the combination of both science and an art, these two things give us the ability and desire to help the individuals cope with their needs. Ibig sabihin, we are not just doing our nursing care out of compassion, which is art. We are also using our minds or the science behind our nursing practice to care for our patients. So it's the combination of our heart and mind, science and art, that makes nursing special according to Faye Abdella. Like I said a while back, Faye Abdella also believes that nursing is a humanitarian service. And as a complete humanitarian service, nursing responsibilities include the following. Nurses should be acquainted with the nursing problems of the clients. So we need to understand our clients even more, become acquainted with their concerns and problems so that we can help them. We also have to choose the definite course of action to make in the scope of relevant nursing principles. So ibig sabihin po, we should also consider planning our care for our patients and choose or pick courses of actions or mga procedures natin that we can give our patients that are appropriate to their nursing needs. Aside from that, make available continuous care of the patient's or the individual's entire health needs. So, ibig sabihin po nito, we should also be able to address all the health needs of our patients, be it physical, emotional, psychological, sociological, and others. And also give continuous care to relieve pain and discomfort and provide immediate security for the individual. So like I said a while ago, us nurses should also assist our patients to address these 21 problems. Aside from that, to be a humanitarian service, nursing should also include regulating the total nursing care plan to meet the client's entire health needs, or ibig sabihin, we nurses should see to it that the nursing care plan that we give to our patients are holistic and it is not just targeting the main problem of our patients, but it is also targeting the holistic individual. So it includes physical, emotional, mental, social, like I said a while ago, holistic care for our patients. So we have to regulate the total nursing care plan to meet our clients' entire health needs. Aside from that, nursing should also serve the individual to become more self-determining in achieving and maintaining a healthy state of mind and body. So it doesn't mean that we should be spoon-feeding our patients. We should also, as much as possible, help them become have self-efficacy, or that they should also be more involved in their achievement and maintenance of a healthy body and a healthy mind. So dapat po, hindi lang tayo yung nagtatrabaho para sa ating mga pasyente. They should have active involvement in their maintenance of a healthy mind and a healthy body. Aside from that, nurses should also inform the nursing personnel, the family, and the support system to provide individual act for oneself within perceived limitations. Aside from that, Faye Abdella believes that there should be collaboration between not just the nurse and the healthcare team and the patient, but also to the significant others of the patient. So, ibig sabihin, lahat-lahat po tayo ay may ambag sa ating mga pasyente for them to achieve and maintain a healthy state of mind and a healthy body. So, ibig sabihin, tulungan daw po dapat yung ating mga nursing personnel, family, and support system to provide individual acts for oneself within perceived limitations. So, yun po yung ibig sabihin ni Faye Abdella. And nursing should also include the facilitation of the individual to adapt to limits and emotional problems. So, ibig sabihin, we also help our patients cope with their emotional problems. So, hindi lang po dapat yung mga physical problems nila yung ating inaalala or ina-assist. We also assist them to cope with their emotional problems as well. For nursing to be considered a humanitarian service. So like I said, all around po dapat tayo yung service na binibigay natin, or it should be holistic in nature. Aside from that, we nurses should also team up with different allied health professions for optimum health on the local, state, national, and international level. So, ibig sabihin po nito, we nurses should involve ourselves in problems that are pertaining to health when it comes to local, state, national, and international level. So, ibig sabihin po nito, dapat daw tulong-tulong po tayo to attain a healthy humanity. Ibig sabihin, pagtutulungan-tulungan dapat lahat natin, mga nurses, ang mga problems natin concerning health, not just in our locality, but also internationally. Take for example the case of COVID-19. During the COVID-19 pandemic po, we nurses have put ourselves forward. May mga nurse researchers po tayo, may mga frontline workers po tayo who are not just taking care of the people in their own country but are also sharing their knowledge, their research results to other people. Kaya dapat po we should also be included. We should include ourselves in this global problem so that we can all attain a healthy humanity or a healthy human race. Yun po yung tinatawag natin na humanitarian service as part of our nursing roles. Aside from that, we should also engage in non-stop evaluation and research to develop nursing techniques to create new techniques to serve the health needs of different people. So dapat po, as nurses, we should not get tired of improving ourselves, continue studying, continue doing research, continue experimenting so that we can come up with better ways on how to care for our patients. Kasi nga, kung humanitarian service po ang ating nursing, dapat po ay pinapaganda natin yung ating mga services na binibigay to our patients because we know that the needs of the patient are also ever evolving and ever changing. And so, we should also engage in non-stop research and evaluations for us to develop new nursing techniques to give a better type of care to all our patients. Now let us look at the meta-paradigm in nursing of Faye Abdella. The concept of nursing in her theory is generally grouped into 21 problem areas for nurses to work out their judgment and appropriate nursing care actions. So according to Faye Abdella, tayo daw mga nurses is that we are able to look at the problems or categorize the problems of our patients in 21 problem areas and that ginagamit natin ng ating judgments so that we are able to plan our care for our patients. So we look at the 21 problems of our patients, kasali ba dito yung mga problems ng ating pasyente, and by that knowledge alone, we are able to plan our nursing actions. When it comes to person naman, Faye Abdella classified the beneficiary of care as individuals. However, Faye Abdella did not give any more mention of person, so hindi na siya nagbigay ng mas deeper na explanation if the person can also mean an individual, a family, a society, a community. Hindi na po siya nagbigay ng deeper explanation. So she just said that a person is classified as the beneficiary or the recipient, yung taong nagre-receive ng care from the nurses. So yun po yung concept ni Faye Abdella of a person. Now, for Faye Abdella, health is defined as the center and purpose of nursing services. Ito daw po yung reason kung bakit tayo may nursing, to improve the health of the people. Faye Abdella did not give a definition of health, although she spoke of total health needs and healthy state of mind and body in her own description of nursing as a comprehensive service. So, like I said, Faye Abdella thinks of nursing as a humanitarian service and that we should give total health needs of the patient or holistic approach to our patients, and we should maintain a healthy state of mind and body of our patients. So yun po yung definition ni Faye Abdella sa kanyang meta-paradigm in nursing when we speak of the word health. When we speak of environment naman po, the idea of environment is addressed by Faye Abdella in her statements that we should plan for optimum health on local, state, national, and international level. So ibig sabihin, us nurses should work within our environments to help everyone attain an optimum level of health or a healthy state of mind and body. So ibig sabihin, hindi lang daw po tayo nagtatrabaho as nurses in our local area, but also in our state, national, and international communities. So yun po yung meta-paradigm in nursing ni Faye Abdella. Now, what are the 21 nursing problems according to Faye Abdella? Number 1 is we have to maintain good hygiene and physical comfort. And if the patient is not comfortable and there is poor hygiene, the patient will get sick. Aside from that, we also have to promote optimal activity, like for example, exercise, rest, and sleep, because without these, our patients will become infirm. Di ba nga po, pag walang exercise, walang matinong tulog, or hindi tayo nagre-rest or nagpapahinga, nagkakaroon tayo ng problema. So yan po yung first two na nursing problems according to Faye Abdella. Next is we have to promote safety by preventing accidents, injuries, or other trauma, and preventing the spread of infection. So yun po yung isa din na nursing problems natin is we want to safeguard our patients' health by making sure that they are free from accidents and injuries and other trauma and hindi sila nagiging infected. Aside from that, we also have to maintain good body mechanics and prevent and correct deformity. So dito po pumapasok yung ating body mechanics, bodily kinesthetics, or movement. So dapat din po maganda yung ating mga posture according to Faye Abdella, because if not, that will fall under the 21 nursing problems. Aside from that, we nurses should also facilitate the maintenance of supply of oxygen to all body cells, or we have to help our patients make sure that all of their body cells are properly oxygenated. Kaya nga po, priority natin na mga nurses ang airway, breathing, at circulation, because that also falls under the 21 nursing problems. Aside from that, we also have to facilitate the maintenance of nutrition for all body cells and make sure that our patients are getting the right nutrition that their body needs. So dapat kasama dyan yung mga macro minerals, including your carbohydrates, proteins, and fats, and micro minerals, including your vitamins and minerals. So yun po yung dapat na tinitignan din natin in our patient for them to facilitate or maintain the nutrition of all their body cells. Number 7 is to facilitate the maintenance of elimination. So, dapat po maganda daw yung excretion, yung sweating, yung pagtae or ihi ng ating mga pasyente, because if not, that will also fall under 21 nursing problems. If I'm not mistaken, parang halos pareho sila ni Virginia Henderson. Diba? Yung mga 14 needs ng ating mga patients. Aside from that, we have to also facilitate the maintenance of fluid and electrolyte balance and make sure that our patients have the right electrolytes and hydration. If not, kailangan din natin silang mga sweruhan or increase oral fluid intake, or also control their mineral intake or electrolyte intake. So yan din po yung mga problema natin sa ating mga pasyente, their fluid and electrolyte imbalances. So dapat balansehin daw po natin yon. That's part of the 21 nursing problems. Number 9 is to recognize physiological response of the body to disease conditions. For example, pathologic, physiologic, and compensatory. And we have to make sure that we are also able to understand the problems that are happening to our patients. Kunwari, kung yung isang pasyente kasi natin ay merong heart problem, usually nagkakaroon sila ng mga added problems din or complications that we also need to look into. Yun po yung tinatawag natin na pathologic, physiologic, and compensatory na consequences of their condition. So again, do not just only look at the main problem, pero titignan din natin yung mga branching of these problems, because that is also part of our 21 nursing problems. Aside from that, we should also facilitate the maintenance of regulatory mechanisms and functions or coping mechanisms of our patients, and facilitate the maintenance of sensory function. When we speak of sensory function po, ito po yung mga feeling na nararamdaman natin ng mga patients. Okay? So pag tinatouch mo yung makha ng mga patients, nafe-feel dapat nila ito. If not, if a patient cannot feel something in their toes, in their hands, in their faces, ibig sabihin baka meron silang mga problems when it comes to their nerves or problems when it comes to their mismong brain. Okay? So, if a patient cannot fully sense a stimulus, ibig sabihin that also falls under 21 nursing problems. Aside from that, we should also identify and accept positive and negative expressions, feelings, and reactions of our patients, or allow them to communicate or verbalize their feelings, and also identify and accept the interrelatedness of emotions and organic illnesses. and also to facilitate the maintenance of effective verbal and non-verbal communication. So yung pasyente po natin, pag hindi sila nakakapagsalita or if they are not able to express their emotions, that may also fall under our nursing problem, which we can also address. So, pati ba naman yan, sir, pinoproblema din natin? Yes, because like I said, the concept of nursing of Faye Abdella is holistic in nature. Healthy mind and a healthy body. So, dapat po ginagawa pa rin natin itong mga to, even though we feel that sometimes it's not anymore part of our purview or responsibility, dapat pa rin po ay atin itong ginagawa. Now, as nurses, we should also promote the development of productive interpersonal relationships. So, if a patient does not have any social life, we also have to make sure that we integrate them in our society. Again, holistic approach to nursing po ang gusto ni Faye Abdella. We also need to facilitate progress towards achievements and personal spiritual goals. So, if a person does not believe in a higher being or a higher order, we also have to assist them in their expression of their beliefs and faith in pwedeng Allah, in God, or in other deity or other figures of strength or spirituality. So yun po yung isang ginagawa din natin. Aside from that, we also have to create and maintain a therapeutic environment for our patients and facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. Dapat daw po tinutulungan natin ang ating mga pasyente to become more self-aware of what they need, what they want in terms of their physical, emotional, and developmental needs. Aside from that, we also have to accept the optimum possible goals in the light of limitations, physical and emotional. So, hindi lang daw dapat po yung strength ng mga patient ang ating tinitignan or mga needs ng mga patient ang ating pinagfufokusan. We also have to make sure that the limitations of our patients are recognized and that our patients are able to address these limitations. Aside from that, we also have to use community resources as an aid in resolving problems that arise from an illness. Kunwari po, kailangan din daw natin ginagamit yung mga available na resources natin in our community to resolve the problems from an illness of a person. Kunwari, if a patient has hypertension or diabetes, so ano yung mga community resources na pwede nilang gamitin? There are free resources from the RHU, mga maintenance medications natin, like for example metformin or yung mga captopril, yung mga ganong tipo, yung mga amlodipine, those are used for control of hypertension. So, pwede po nating i-refer yung ating mga pasyente to go to the RHU so that they can use these community resources. Aside from that, we can also teach our patients to use mga herbal plants or mga halamang gamot. These are community resources that they can use to improve their health. For example, a patient with diabetes can take ampalaya, which is also promulgated by the DOH as one of the 10 halamang gamot na mabisa in the cure for diabetes. Kung yung pasyente natin may hypertension, we can also ask them to take garlic every day kasi yung bawang po, they can also decrease hypertension according to the Department of Health. So aside from that, number 21 is to understand the role of social problems as influencing factors in the cause of illnesses. So ibig sabihin po nito, dapat daw po ay minumulat natin yung ating mga pasyente to understand that social problems in our society are sometimes the cause of our illnesses. A good example of that is poverty. Kung yung isang pamilya po ay dikit-dikit sila sa isang lugar or marami sila sa isang bahay under one roof, then pwedeng yun ay maging factor for the spread of tuberculosis. Or pwede din pong ito yung reason, poverty can be a reason for malnutrition. Or poverty can also become a reason as well for patients not receiving vaccinations. So, dapat daw po minumulat natin yung ating mga pasyente to understand that social problems are sometimes the cause of our illnesses. So that those are the 21 nursing problems according to Faye Abdella. Now, Faye Abdella also believes in the importance of the problem-solving approach when it comes to our nursing care. According to Faye Abdella, we have to first identify the problem. And then pag na-identify na natin yung ating problem, be it in the community, on the individual patient, in the family, the next thing that we have to do is select relevant data. So, dapat po ay mag-gather na tayo ng mga data to support our identified problem, and then we have to devise a hypothesis. And then after that, we have to test the hypothesis through the assortment of data or experimentation, and then after that, we should revise the hypothesis when necessary on the basis of conclusions obtained from the data. So yun po yung problem-solving approach according to Faye Abdella. Now, is the theory of Faye Abdella still accepted at this day and age? The answer is correct. Yes, it's still accepted by the nursing community, and in practice, the 21 nursing problems by Faye Abdella helps nurses and nursing students identify the problems and perform scientific ways or systematic ways in addressing these problems. Because of the 21 problems na pinorward ni Faye Abdella, we are now able to pinpoint the problem areas of our patients in practice or in the clinical setting. In education, the typology of 21 nursing problems had the most potent effect in educational system, and majority of the subjects that we are teaching nursing students are based on the 21 nursing problems of Faye Abdella. And in research, ginagamit po natin yung 21 nursing problems as theoretical framework in research, and that more research studies are using these 21 nursing problems as part of their theoretical grounding. Now, let us also have a theory analysis of the 21 nursing problems by Faye Abdella. As to clarity, all the terms are consistent and easy to understand and are all nursing related. So lahat po ng mga problema na finorward ni Faye Abdella in her 21 nursing problems are easily understood by not just nurses but also nursing students. Aside from that, it is also simple. The typology is straightforward and is practical to use among clients. You don't need to be a rocket scientist to understand the 21 nursing problems forwarded by Faye Abdella. Aside from that, it is also generalizable. As to generality, the typology of 21 nursing problems are collective and associated with time and environment. So, ibig sabihin, very relevant po until now yung ating mga 21 nursing problems because it also has an effect in time and the environment. It is also accessible. The concepts are very exact with the empirical reference that are easily recognizable and that we are also studying that. Therefore, we nurses are able to use our empirical knowledge to put this understanding of the 21 problems of Faye Abdella or 21 needs of our patients by Faye Abdella into practice. And lastly, as to importance, the importance of problem solving is not restricted by time or space, and it gives a way for continual growth and change in the service of nursing care. So yung mga problema naman na finorward po ni Faye Abdella, it will stand the test of time. These 21 problems po will still be the problem on the 21st century. So until the time that these problems will already change, this theory of Faye Abdella will also stand the test of time. And that ends our pre-recorded video lecture for the subject Theoretical Foundations in Nursing. And this is already the end of our discussion. But before that, let us have an attendance check. For your attendance to be considered today, you have to send a voice memo of the chorus of your favorite song, and then also forward a screenshot to prove that you have already subscribed to my channel. I will be sending a link to this video on our Facebook group. Make sure that you have already subscribed to my channel. Take a screenshot and then upload it on our Facebook Messenger. So dapat po ay naririnig ko po kayong kumanta for your attendance to be checked today. With that being said, maraming salamat everyone for listening. Please open your cameras for our picture taking so that we can enjoy the rest of the day. Please turn on your cameras na po.